Bienvenidos and welcome a Cositas Mommy Never Told Me, a podcast that dives deep into the Latin cultural norms that have long haunted the feminine genre. Móntate and buckle up porque it's going to be a roller coaster ride. Nos fuimos!
Hello.
Hey y'all, what's up?
Hi, everybody. I usually say hi, and it annoys Diana.
It doesn't annoy me at all. But if you want to be known for a long hi, girl, do your thing.
Okay. Anyway, we are on a semi-serious podcast today. Not really, because even though the man on the screen is extremely well-respected and very intelligent and very serious, he's not. He's my homeboy, and he's already seen my tits.
Took some away.
Some of my tits away. Thank you, Jesus. Dr. Payman Danielpour, everybody. We have been wanting to do a podcast about plastic surgery for a while. We wanted to do kind of a summer edition, but of course, real life happens, and Dr. Payman actually has to leave from this podcast today to a surgery. So he has been gracious enough to be up at 6:30 LA time to appease me because I'm his favorite client. Tell them I'm your favorite client ever.
By far my most favorite client ever. Anyone that knows you loves you. My whole office loves you.
I love all them girls. And they're literally, Diana will, please, before we let Dr. Payman introduce themselves, because this is so organic. Diana was one of my good friends that came and helped me recover after surgery. And she came with me to my first post-op. She just didn't come into the office. Dee, tell them how you felt when you went in.
Well, first of all, I go down to California, and she tells me, "Oh, I'm just getting this, this surgery, breast reduction, because she always makes everything that's big. She makes it look like it's small, right? So you're like, oh, okay. I'm thinking she's gonna go to Cedars-Sinai, whatever that hospital in California is, right?
Oh, Cedars-Sinai.
Cedars-Sinai, right? So I'm like, okay, whatever you need. We roll up in Beverly Hills, like, what? Immediately, I'm like, shit, I'm underdressed. Like, what's going on? I'm like, okay, whatever. Okay. Then we roll up on your building, which I've seen on numerous TV shows. Like if you watch anything having to do with California, your building is in it, right? So I was just like, I've seen this building before, right? So then we go upstairs and we're passing all these offices for different type of procedures that you need. So I'm just like, oh shit, I might need that. Oh yeah, that too. But we go in your office, and I have to tell you, I sat there and I felt like I was a millionaire. You know what I'm saying? Just like the aesthetic of your office. All the girls are beautiful. They're all so nice, because usually when people look like that, they're not nice. They're all very genuinely nice. What do you need? Are you okay? Would you like something to drink? And I was just like, shit, I could sit here all day. Right. So that was my impression of your office. And your partner, he was also very nice when he came out. And he also, very
Layke.
nice, oh my gosh. And I was just like, this is amazing. But I also know that Rocio is not one that's going to just be picking something out like some of the people that we know locally that would just go like this. I'm going to this doctor and then just open. This is where I'm going, just because they've seen a couple videos or whatever. So I just wanted to give you that feedback that whatever y'all doing in that office, it also smelled good. Whatever y'all doing in that office, it's working. And she tried to downplay it like we was going somewhere, but it was your office and it was amazing. So go ahead, Rocio. Sorry.
Thank you. Honestly, that makes me feel so good, because it's been 15 years in the making, and we just constantly that's the key, for someone to walk in there and just feel special. Because that's what we really are trying to make everybody do, whether they're from Beverly Hills or they're from out of the country or out of the state or in a different area in LA. We want everyone to feel like they're very special because they're having a procedure done. They're at their most vulnerable moment when they walk in. So making them feel really good and feel really special makes it a lot easier for me.
Are the walls lined with fur? Because your chairs were gold. I don't even know. Like you could have, it was such a vibe. You could have like
you see this wall behind me?
It's
amazing. Alligator.
See?
I got crocodile on one and an alligator. Obviously fake, but the look.
Yeah,
so we try to make it really
amazing. It was amazing. So get ready to spend some coins if you're going to Dr. Payman.
I love that.
His money is quiet. So, Dr. Payman, tell us a little bit about yourself. Tell us, I was curious, is medicine or the medical field in your family? I would love for people to get to know you a little bit. And then kind of what you guys specialize in. I know you guys do a lot of different things in the office, and Dr. Layke, who's amazing, is your partner. I know he specializes in the face, but if you can give us like a 101 into who you are and kind of what Beverly Hills Plastic Surgery Group is about.
Absolutely. Give me 1 second because this window's open and it's making a lot of noise. Sorry.
Look at that. In LA, they have noise. People, Beverly Hills.
I love
Noisy.
that painting behind them.
I mean, I don't want to know how much it cost.
No, that's probably how the artist saw him, and that's probably just how close he was to being who he was.
So
we were commenting on your artwork behind you.
Yeah. Oh, this one?
Yeah.
Yeah.
He probably really, he looked
Albert
that
Einstein.
way, but I'm sure inside he looked like that. Go ahead.
Exactly. So, long story short, the reason I'm a doctor is because my grandfather, my mom's father, practiced medicine for I want to say almost 60 years. But he was an internal medicine doctor, old school doctor, like the kind that you went to and put his hand on you and could tell you exactly what was wrong, treated you with, non-conventional methods and didn't throw medicine at you, and just everyone loved him, he just made everyone feel good. And I grew up in his office. And as I was growing up in Beverly Hills, everyone wants to be famous. Everyone wants to be an actor. Everyone wants to be a singer. And I was in that world for a little while, and he sat me down and he said, you're at a transition in your life where if you don't choose medicine, if you want to be a doctor, you're never going to be able to do it again. But you'd always come back and do everything else. You could be an actor, a lawyer, a politician, a businessman. But once that window for being a physician or being a doctor is gone, you can't go back and do all that studying because it's way too long. So it really kind of lit this light bulb in my head. And I said, okay, I'd already gotten into med school. I left. I lived in Europe for a little while, chased a girl, and thought I was going to go to film school. Came back and I said, no, this is for me. And went to med school, then did 2 residencies, one in general surgery, one in plastic surgery, one in Miami, one in New York. Went to med school and undergrad in Chicago, and then came back to Beverly Hills because this is where my family is. And it's interesting because Dr. Layke, who's my partner, and I did residency together. And towards the middle of our residency, I said, listen, I'm going to go back to LA. I'm going to open up a private practice, hang a shingle in the most competitive area in the world. You want to come with me? And he's like, absolutely. So we packed up a car, drove from New York to LA.
Wow.
And that was a little bit over 15 years ago. And it's been fantastic.
I love it. Dr. Payman, tell us a little bit about what you guys specialize in.
So in our practice, the Beverly Hills Plastic Surgery Group, it's really a group. So there's 3 of us. Dr. Layke and I started it. We added a junior partner about 2 years ago. His name is Dr. Cameron Resident, and then we have a nurse injector as well. I do most of the breast and body work. So I'll do everything breast, everything body, and I'll do some face stuff, but I don't want to cross-pollinate too much. Dr. Layke's really an expert in facelifts, neck lifts, and rhinoplasty and everything face-wise. And Dr. Resident does a lot of complicated breast cancer reconstruction and lots of facelifts as well. The beauty of the practice is we operate together a lot. For example, yesterday, we did a case where Dr. Layke did someone's face and neck, and I did their breasts at the same time. One sitting, patient's done, recovering. And it's a lot easier because if one person's doing all that, it takes so much longer. And in all reality, in this time of the world, everyone wants somebody who's super specialized.
Mm-hmm.
Can I do nose? Yes. Can I do face? Yeah. But it's easier if I do breast, because I really am the expert on that. So that's kind of how we break it up. But at the same time, we see each other's patients, still do work at the hospital. I was there this morning doing breast cancer reconstruction because sometimes it's necessary to do that stuff just to give back to the community as well, because it's great. It's like being Robin Hood. You've got this beautiful practice here, but then there's people that need work that don't have the funds and don't have the money. And if you can give back to them, it really is nice because God gives you this talent that you work hard to do. And if you can give it back, it's fantastic.
What about discounts? I'm just joking. But not
Diana's
really.
like, let's get to the discount.
But anyways, the importance of board certification, right? Because so important. I've heard stories online, on TV, through friends. You can't have a dentist do your breasts. Like, can you talk a little bit about how important it is to make sure that whomever you're tapping into to get your breasts, your whatever done, that they're board certified and that you're doing the research that you need to make sure that person is not showing fake papers on the wall or wherever the case may be?
That's really it's a fantastic point, because what's happened is now, unfortunately, the regulatory bodies in the United States allow any doctor to do anything. I can deliver your baby if I was in an area where no one else was there, right? But unfortunately, what's happened is medicine in general, the reimbursements have gone down so much for most practitioners where it's insurance-based that everyone wants a piece of the cosmetic pie. So now there's these fake boards called the cosmetic surgery boards, and there's a lot of smoke and mirrors out there, especially with TikTok and Instagram and Facebook, that people can say that they're somebody where they're not. So what you need to do to really vet out your surgeon, very simple. You go to the American Board of Plastic Surgery website and just look to see if your doctor is board certified. And board certification is a very arduous and strenuous process. You have to do the proper training, which takes at least 7 years minimum after med school. And then you have to take a written board, and then you have to take an oral boards. Now, the pass rate when I took the oral boards was less than 50%. So even perfectly trained individuals that have done 7 to 8 years still didn't pass the boards, because it's so difficult to get through. It's necessary, because if I'm going to cut you, I better know what I'm doing. So interesting part is, go back and see Kanye West mom died of plastic surgery, not board certified.
Wow.
Most board certified surgeons, the key to it is they're safe. And that's what you want. You want somebody who's safe. And really, it's not going to do something where you come in for an elective procedure and you don't go home. So definitely vet your plastic surgeons out. Definitely make sure they're board certified. And definitely make sure that if you're going to go to them, the best is to get it from another friend or somebody you know says, I had a great experience with this girl or guy. Go to them, feel them out. I think that's how you and I met, Rocio.
Yeah.
Because I think one of your friends said. So I think very important, great question. Definitely vet them out. American Board of Plastic Surgery. Make sure that they have it, and then you're safe.
I want to piggyback off that. One, is that certification a America, USA thing? Is that something that is global? Because of course we want to get into the fact that I'm not sure that Kanye's mom had the surgery abroad, right?
No, I think he was here in Beverly Hills, but the guy just wasn't a board certified plastic surgeon. He was a guy that he did too much on somebody who wasn't medically.
Oh, right. She was not healthy enough, and they told her no somewhere else, and she just wanted it done. That I believe that's what it was. So yeah, is that certification?
When it comes to celebrities, also, it makes things a lot worse, because again, I've operated on a ton of huge celebrities, and they want you to jump through all these hoops. And that board certification matters, because you go back in your head and say, I don't care who you are. These are the things you need to do. And if you're not cleared by your doctor, or if I see something that's going to make you even a tiny risk, I don't do it. Because the last thing I want is for her to look great, but then, be a corpse.
Yeah, that would matter. So the board certification is board certification is something here in the U.S. It's not a global certification.
So the board certification in the United States is the American Board of Plastic Surgery, and that's an actual board that you have to take exams and things like that. Now, there's a lot of other societies around the United States, like the American Society of Plastic Surgeons that I'm a part of, hold a few positions at. And then there's the International Aesthetic Society of Plastic Surgeons, there's the American Aesthetic Society of Plastics. There's a lot of societies, but board certification is only in the U.S. You have to be trained here. You have to take a bunch of tests. And other countries don't have this type of work.
Because we have a lot of friends that go, oh, sorry.
Yes. No, go ahead.
We have a lot of friends that, I won't say any names, but y'all listening and y'all watching. But anyways, we have a lot of friends that go to Colombia. We have a lot of friends that go to Santo Domingo, the Dominican Republic, and it's chasing, the BBL, the breasts, the chin lift, the facelift or whatever, right? But they don't have the $20,000 or they don't have the $50,000 because usually they want multiple things done at the same time. And then they see something that's like $11,000 or $8,000 and we'll throw this in. And I'm just like, hold on, what they throwing in? Like, you have to go fly somewhere and then go to a heel house, which is going to cost you another $2,000 or $3,000, right? So they make all these packages and stuff. And to me, in the back of my head, I'm like, shit, if you got to go somewhere else, like, this is your one body. This is your, like, one, you have one. Like, if you die, you die. Like, so I think that Rocio was just asking that because it's crazy how now you can just go anywhere in Colombia. For instance, my friend went and thank goodness nothing happened to her, but she said that she went on a strip and you could get anything done on the street and it was storefront. And I was like, what? It was nose jobs. It was, new teeth. It was whatever you wanted. And it was a storefront, no medical building. So how crazy has it gotten, botched jobs, especially coming to you, right? Because I feel like you need a botched TV show. I'm sick of the other two guys. So I'm just saying, like, you guys look better too. You guys look.
You make such a great point. And for the most part, interesting part is you can go and probably get a nice procedure. And because they do so much of it, some of these guys are really great. I mean, there's a guy named by the name of Dr. Hoyos in Colombia. He might be the best liposuction surgeon in the world. He teaches all the time. So there's the one-offs. They're excellent. And again, for the most part, you're probably going to be fine and save a ton of money and do all kinds of things. Problem is if you're that percentage, and I'd probably say it's as high as 10%, where there's some real complications, you leave, right? You go back to Connecticut, you go back to New York, you go back to LA. And then who's going to take care of it?
Your post-op.
And that's one of the biggest parts. Mm-hmm. And I've seen a lot of botched jobs, especially the BBLs. My Lord, I mean, you see crazy things. I don't recommend it. I agree with you, Dee, in the sense that you got one body, but the problem is prices are sometimes higher, and people look for alternatives. I was talking to some people. I was in Mexico because we've got another business up in Mexico, but they're doing teeth. For literally like a tenth of the cost. You can get a full mouth for like less than 10 grand. Whereas here it's 100 grand. So it's a huge difference for people. And if you find and vet the right person, maybe it's okay. But what happens if something goes wrong? There's also people who are doing lenses where here, if you want to put a lens in your eye, electively, it's like $35,000, $40,000. Mexico, it's $5 grand. So I get it, some of this stuff, but at the same time, I think the biggest part is if something goes wrong, you have no one to go to. And then the worst part is, what if really something bad medically goes wrong? You get a deep venous thrombosis or real bad stuff. So I've seen a lot of it, people going all the way to Turkey, all sorts of crazy stuff. And I don't recommend it. We have our own podcast. We did a long podcast on surgical tourism. I think it's just easier to do something in your backyard. I see a lot of patients from New York, from all over the country that come to us. I make them stay sometimes for 2 weeks, make sure everything is good. And then we've got FaceTime. But the key to it is I got plastic surgeons in your neighborhood. So if something is going wrong, I pick up the phone and call my buddy. And I said, hey, Rocio's coming. She had a breast reduction. I want her to, I want you to make sure everything's okay. Whereas the guy that's doing it in Tijuana doesn't know me. So it makes a big difference. And there's real statistics out there that show that this is really not.
Yeah. I mean, I definitely wanted to point out that we're not saying that doctors in other countries aren't extremely intelligent and great at what they do. We just found that it's it's the price point is very enticing, and also the medical limitations on from what I understand, and I would love for you to educate us on that, is like, I'm sure here there's a certain amount of liposuction that you can do on someone who's a certain weight, and you go to another country and they will like take out excessive amounts of lipo. It's like they basically will give you what you want. So it's like you pay less, the risks are higher, and they just per country do not have medical standards that they have to abide by. So that's kind of where the dangers come in. Because, a lot of people are like, oh, but I want more. And you as a doctor are like, based on this is, we can't do more than this,
That is a brilliant point, and that's one of the biggest differences, because Dee brought it up in the beginning, like, oh, they want to do everything and you do it all. And then you brought up the fact that there are guidelines and parameters, and there are, and they're very strict guidelines that when you do take your boards and you are board certified, you stick to those. Because if you don't, that's when you get into trouble. And a lot of people from other places, they don't do that. So when I hear the amount of fat that's been taken out or put into someone's buttock for BBL, you're like, oh my God, that's insane. And that's where you run into problems. So I think that's, there's really no one watching. There's no policing going on, where we have major policing from, the state board, the federal board, the societies, and the boards that really kind of like, are watching you. And the last thing you want to do is harm anyone. So that's the key, is you stick to those guidelines and everyone's happy and alive.
How much is too much? Because I know I've seen, for instance, a BBL, right? I'm not very good at the nose jobs unless it's like drastic, right? I have a girlfriend of mine who's Greek, and she had a nose job, and it was done amazing. Like I didn't even tell her, so I was like, "Did you cut your hair? Like, what's going on with your face? Like, something's going on." Because I'm very honest, I'm very straightforward. So usually I'll ask somebody, "Did you get a butt? Did you get a BBL, or did you get a?" No, girl, I've been doing squats. I was like, "There's no number of squats that's gonna do that. Like, what are you talking about? I've known you since the second grade. You've never had an ass. Like, what's going on?" But how much is too much? And have you ever found, because I know you said something about celebrities and they want you to jump to loopholes and all that stuff. But how much is too much? And have you ever said, you know what? No.
I do all the time. So too much. So there's guidelines. Like, for example,
he does all the time, because I wanted lipo in my stomach and he said no. And every time I go, and I'm going to say, every time I go to check on my breast and laser and all the things, because tons of questions came up after my video of like, oh my God, your scars look amazing. And I have 2 girlfriends that have gone to Dr. Payman, and that's really how I landed after doing 3 years of research. But then I met him, and as you can see, his bedside manner was amazing. It was like, for me, that was, everyone has different priorities in what they're looking for. And for me, that was important, that I felt like even though he does 100 surgeries a week, that he was really concerned about mine. You know what I'm saying? So I had my breast lift, and I said, I want to get some lipo here. And he literally straight said, no. He's like, no.
You don't need no lipo.
He said, I could do it, but you will have a lumpy stomach, which therefore means I'm not going to do it. So I was like,
I told her she didn't that she didn't need it. And then I proceeded into putting my gut on her shoulder. And then I told her, I need the lipo. So when I said discount at the top, if you do really offer one, especially for Rocio's friend, D, let me know.
Let's do it. No, it's interesting what Rocio's saying is, I say no, I draw the line. I had a big celebrity that I operated on probably about a year ago. Probably as big a pop star as you can get right now. And I did some stuff for her, and she wanted me to do a lot more. And I drew the line and I said no. And she's been fairly open with showing everything recently on everywhere she is. However, I drew the line, and I just saw her again about 2 weeks ago. And she's like, I love you because you didn't push me to the limit, and I'm back because I want to do those other procedures now. And I said, hey, that's better. We saw how everything's settled. We can do little tweaks on things and do a little bit more. You don't want to put your body in shock. You want to do enough where you can handle it and recover it and make it so it was a nice post-operative recovery period. So it's not so miserable. You're like, why did I just do that? So that's one of the pieces of it. The other is what you said earlier is, is that, we've developed this relationship. All my patients have my cell phone number. I feel directly responsible for it. So if I mess you up, you're going to blow me up all day long. And I think it's important to have that communication that you and I have had over, forever. You're my friend now, as much as I've operated on you. When I see a text from you, it makes me smile. And I want that with everybody, right? Now, everyone's not as cool as you are, and as fun as you are, and as funny as you are. But at the same time, I think it's important. Other people are like, I can't get in touch with my doctor. And all of those little nuances that kind of make things you feel safer. And that's what's important.
Yes, because just so people understand, that is very not, I don't want to use the word normal, but that's not the standard. Like, I have a very strong personality in the sense of like, I kind of know what I want. I know what I don't. And to me, if I didn't feel that kind of candor with my surgeon, being that I thank God I'm medically very healthy. So this was my first real surgery. And if I wouldn't have felt that, it was like, I wasn't going to do it. In full transparency, I did visit 2 other doctors, but I felt like it was very much like one factory. And I felt like it was very much like breast reduction, enhancement, implant, lift, and this very typical Barbie-esque transition. I want to say, like what you think of Beverly Hills. And when I went to Dr. Payman, he was like, no, you don't need an implant. We don't need that. He's like, I'll do this and lift and blah, blah, blah. And it was more the comfortability. So I did want to publicly give you those flowers because that was for me the most important thing. It was like the cell phone, that whole thing came after, but your initial, just like warmness in the office, because it's like Dee said, you're in Beverly Hills, so you have all these imagined notions where you're like, oh, this shit must be like the craziest thing and super expensive and bougie. And then you meet you and Dr. Layke, and it's like, oh shit, like they're really cool, which again is not the standard in Beverly Hills. It's just not.
And it's interesting. It's really not the standard in a lot of places. Just period. The doctor. Most people that become doctors have very little personality. They're very intelligent, but they don't really know how to deal with people one-on-one. And I do think that in this world of plastic surgery, if you can't have that connection, you're in trouble. And I think that it's important that whoever you pick to do your procedure, you should be able to be really comfortable with them because you're getting something done and it should be to your liking, not to the surgeon's liking. You should explain to them, this is what I want. And he or she should be able to be like, yes, I can do that for you. It's going to work for you, or no, and guide you down the path. Because if you're not comfortable, and with plastic surgery, things cannot look as you want them to, and you may have to tweak it a little bit. You may have to, and it should be very easy to have that conversation and not be like, I feel nervous talking to this guy. He's going to be like, no, you did something. Or it should just be very open. So you're going through this journey that they should kind of really be there.
Well, speaking about giving flowers, like right after the surgery, just her recovery time was amazing, right? And that's kudos to you because I've known people that have been down, and she was immediately trying to do stuff, and I was like, you need to relax, because if you know Rocio, she is like, she wants to do it all, right? But then it's like, wait, how long are you supposed to be resting, right? So then it was the whole, I think I looked like a boy. I was like, get the fuck out of here. Do you see your tits? Do you see your tits? Because my tits are nearing my belly button. So to me, when she put on a tank top, I said, Rocio, you got a fucking tank top on. And she was like, you're right. I haven't been able to put a fucking tank top on. And then she brought out these, because Dr. Payman, when I tell you this woman had these fucking tops for her bathing suits to cover those big ass areolas she had before. Oh my God. I would be like, Jesus Christ. But then at the same time, God knew not to give me big titties, because I've always said I would wear a wife beater, which is a white see-through tank top, and would carry water and just pour them on my titties. Just cause.
All day long.
But anyways, So the job that you did was amazing. I just wanted to give you kudos because, again, as I've told you, I've seen people in the past and they're not happy with what they gotten. And, you know, they're okay with it now, like after they heal and all that stuff, and they kind of have to live with it. And some other people have to go get one lifted just to make them symmetrical or whatever. And you know, you try to be that friend that's like, well, you know, one titty's always looking to the left and the other one's looking up. You know, you try to do that.
Not after I paid
like,
$30,000. No, ma'am.
Right, not after Dr. Payman.
No, ma'am.
You're like, hold on. You know,
I
then I
need
go home and I'm
both-
like, damn,
I
my
need
titties
both-
look jacked.
I need both them bitches to look straight. Okay, we need you to look
Well,
straight.
your titties is looking straight. Your
They look
titties
straight.
are mesmerizing. Okay, your titties can fucking hypnotize some folk. Okay, they
Thank you,
hypnotize
Jesus.
me. Okay, those some
Payman.
titties you got, girl.
Yes.
She is not shy. She walks around
I
with them
know.
things out.
Just out. But Dr. Payman, talk about the importance of post-op, because what I did get a lot of in the video reel that I created, which my tits broke the internet. I got like 60,000 views, which was insane. But a lot of people were like, oh my God, your scars look amazing. Like they asked about scars, and then I reposted on my stories and everyone was like, your scars look amazing. Yeah. And for me, honestly, if Instagram wouldn't block my video, I would show my breasts. Like I'm very that person, just for an informative perspective. But I did get hit up by various women who have had the work done and who are so upset about their scarring. And I would love for you to talk about the work that Beverly Hills Plastic Surgery Group does for post-op, because when I mentioned that there's a laser that every time I'm in LA, I go and get my laser treatment and it's offered as part of the surgery. You know, the fact that you and I are constantly touching base, and I saw you a few months ago, I was like, oh, this doesn't feel good. Is this scarring? You look at it, you at least make me feel like, no, totally normal. You look great. What is the importance, or can you just talk about the importance of the post-op? Because people feel like, oh, I have this procedure. And I do have a friend here who went to Colombia, got work done, and then had some difficulties here and had no post-op to go to, you know, thought she can do the wooden massages and the this and the that. And now 3 years later, she's about to go back to get it fixed. So there's so much importance behind the post-op.
So it's probably, you know, the conversation I have with everyone is the same. I said, you know, the majority of the procedure is me, you know, and everything goes well. Then there is you. And there's things that you need to do. So if there's liposuction, you need massages. If there's fat transfer, you need hyperbarics. And I have a protocol for everything. But when it comes to scarring, Dr. Layke and I have done extensive research with doctors at Stanford, and we came out with scar protocols, including something called Embrace, which is a scar treatment system. But over the years, I've kind of evolved and learned what's best for different procedures and different ethnicities, different skin colors, you know, and it's some of the hardest things to treat are darker skin and Latin skin, Middle Eastern skin. I mean, I have a lot of people that come in from Kuwait and Qatar and Saudi, and they've had stuff there and their scars are horrendous. So instead of saying, oh, I'm going to cut it out and fix it, there's got to be other, you know, we have AI now. We should be able to do everything with technology, right? So we use a variety of different types of treatments, from heat-based lasers to non-ablative lasers to microneedling to injectables to just treatments with silicone tape and things like that. I do think the initial closure and the way that the tissue is handled is the most important. So if you really are delicate with the tissue and close it really meticulously and do it all very well, most of the patients do great. But even with Rocio, her scars really probably would have healed just fine on their own, but we hit her with the gold package. Let's do some lasers and let's just treat it as best as we can, because here's the key to the whole thing is if I can do a breast reduction or a breast lift or a tummy tuck where you are making big incisions and those scars fade, well, then it looks like magic. It looks like nothing was ever done. So that's one of the big keys to plastic surgery. Either hide the incisions or make them go away. We've got a long list of protocols to take care of it. Any of you guys that need help, just give us a call.
That's a perfect transition, because I can see that you guys offer neck lifts, rhinoplasty, which is a nose job, just in case you guys don't know what a rhinoplasty is. And I think there's also another name for a tummy tuck. right? Something
It's
plastic.
called abdominoplasty. Yeah.
Abdominoplasty. Look at me doing my research. And then
Yes.
you got boobs. But then I saw that you guys do a Profilo, something that having to do. Is that like a Botox type of
So
situation?
Profilo is a European treatment. It's kind of like another treatment that's given out called Skin V. So instead of filler like hyaluronic acid, Profilo is a skin hydrating injection. So you put it into certain bioaesthetic points of the face, and all it does is it kind of like hydrates your skin. So it doesn't look like you've been filled like a monkey, or chipmunk, sorry, like up like this and filled like this and crazy. But it literally just hydrates the skin. So as we get older, we lose that collagen and elastin in our skin and in our body. And this is a great simple way to kind of give you a little hydration.
And then you said collagen. Is it better to ingest collagen? Because I also saw that you guys have a Beverly Hills MD. Is that a skin line? So for those folks that
that's
can't,
our little baby. We've had it for 10 years.
You can't afford the 30,000 whatever for. But can you talk a little bit about your skin line?
It's so perfect what you said, because 10 years ago, Dr. Layke and I decided to start a skincare line called Beverly Hills MD. Skincare lines catered to those who can't afford to come to Beverly Hills, who can't afford Natural Bissé, which is a cream this big for $600. It takes the best ingredients from the best skincare lines in the world and puts it in an affordable way to get a piece of Beverly Hills in your home. And we have and we have vitamins and supplements and ingestible collagen and all the different types of treatments, whether it's eye patches or face patches and honestly, it is such a great, simple skincare line that doesn't require significant investment, and you really get the best bang for your buck. It's been 10 years. This year, we donate to Smile Train every year. We've donated over $1.5 million to them through proceeds, which is really makes me feel so great because that we get to. But it really is. It's after we get off, I'm going to send you a big box so you can try it yourself.
Yeah, something about.
Dr. Payman, tell us about what's going on in Mexico, because I saw that you guys are super excited about the launch of what's happening in Mexico, but I wanted to understand more because that's really interesting that you guys have decided to go across the border with a business.
So, unfortunately, some of the FDA regulations in this country are so backwards that sometimes you have to take treatments elsewhere that can't be done here. And it's the perfect blend of what we do. So as plastic surgeons, we can make you look better. We can really make you look fantastic. And I can take a 70-year-old, make him look 50. But can I make you feel better as well? And can I make you live longer as well? And now there is actual data. And if you're into this whole world of wellness and longevity and biohacking, which has really become the thing because people have more money now and all they don't have is more time. So we opened up a place called Proactive Longevity at the Diamante Resort in Cabo San Lucas. It is literally a health and wellness center that we do mostly stem cells, whether it's IV or joint injections or hair injections, face injections, but we're taking real stem cells from a variety of different sources, whether it's umbilical cord, placenta, fat, or blood from all over the world, whether it's from Mexico, Lithuania, Germany. We get it shipped over there. And these treatments really are there to prolong life, prolong wellness, and make you feel better. We had somebody that came in a couple of weeks ago. We opened, it's like a soft opening, about a month and a half ago. We've had multiple patients got injected in their knee and their shoulder. They had so much pain, and it's like magic. It's unreal because these stem cells are progenitor cells that go to areas of injury and really go to repair. Unfortunately, again, there's some kind of black market clinics in the U.S. that do it, but again, it's against the rules. So we didn't want to break the rules, and we took it down there, and we're very psyched about it. It's very cool. We have a lot of the experts of the world coming there and injecting people and doing stuff. So our official grand opening, I think, is January 10th or something. But I will keep you updated. It is a very fun project that Dr. Layke and myself and our anesthesiologist, which you met, Dr. Lowenbein, have been working on for 6 years. We've gone back and forth to China and to Europe and obviously to Mexico and finally set it up. It's it is going to be the new age in medicine. You're going to hear about it a lot. Stem cell therapy for longevity is going to be the way to go. And then we have something in office here, which is called therapeutic plasma exchange. And this is going to be another big buzzword you're going to hear. Basically, 3 hours sitting, like if you've ever given blood before, you sit there and they put an IV in, you take 2, and we filter all the plasma out of your blood. The plasma is the liquid part of the blood that carries all the inflammatory cells, all kind of the yucky, bad cells that are there and that just circulate. Take it all out, dump it, and replace it with new albumin, and your body makes new cells. And you really feel like, and it's been used for the last 30 to 40 years for cancer treatments, transplant patients, people that are having, bad kidney disease, just to get the toxins out of their body. But now we've noticed to do it for longevity. And we're doing it all the time now. It's in our office. There's like 3 other places in LA that offer it. So it's very rare to see, but it is going to be that next amazing thing that, and hopefully the cost will come down because it's a little expensive right now, and you should do it at least once or twice a year. But it's super exciting. I've done it. Go ahead.
No, I was going to ask you that if we could get into, and of course it's estimates because I know it's really per client, per job, per body, how things look. But people are going to be like, okay, how much does this cost? Because it's Beverly Hills, the office is glossy, the girls are beautiful, and yes, Dr. Payman is so nice, he's so cool. Okay, but how much is this going to cost?
But he needs to get paid.
Right? He got babies and a wife and a house, 2 houses, 3 houses.
It is a business.
Yes. But I do want to really quickly say that one thing that attracted me to this office was the fact that the 2 women who referred me were Black women. Because for me, I had the knowledge of knowing how my body scarred from like even little things like piercings, or when I was younger, I got a belly ring and I keloided, and that has a lot to do, from what I understand, the melanin in your skin, how your body responds. My C-section with my daughter, how I responded to that scarring. So I know when my girlfriends told me about Dr. Payman, I was like, oh wow, he's worked on brown skin, which a lot of times you don't find because of those little things that you have to have that knowledge that our skin doesn't respond the same way. So I do want to point out that was very attractive to me, that you do work on all different types of skin tones. But yeah, how much do these things cost, Dr. Payman?
I'm gonna go back to that for a second. With what you said. So in all reality, and I don't know if this is going to sound racist, but my favorite patients are ethnic patients, African American, Latina. You know what it is? There's a different respect level. That when I deal with an African American female or male or a Latina, any Hispanic, there's a lot of Mexicans in LA. The respect they have for me, and they show me, is so different than my Beverly Hills housewife that comes in that is just
a monster.
It's just they're so
different.
I don't want to use this word because it's kind of ugly. They're so privileged, and they expect so much more than the other person that comes in. And I just honestly, I love it, and they're all so cool, and everyone's so nice, and I've had excellent results. And it's interesting. I always tell someone that if you look at my website, the first picture is an African American female for breast reduction, because I'm so proud of how well she healed. And I did that one probably 12 years ago, 13 years ago. She was here from Africa, which is the craziest thing. Like, she was actually in LA for Africa for 3 months. Like, weird. That she found me and came to me. But I find that it's important to have this comfortable rapport with a patient. And sometimes, ethnicity makes a huge difference in the way people. It's interesting. I think if you go in with this positivity with your doctor, you get better results than when you go in and you're just so. I do things a little differently when it comes to darker skinned individuals. I do things a little differently when it comes to patients that don't heal well. So sometimes I inject them with something on the table that makes the inflammatory cascade a little less. I'll treat them with different types of scar methods because they may need a little more love, because I don't want them to keloid because it just makes me look bad, and they're not happy. So that, I think there is a difference. I think you should go to somebody who's. It's just like doing the Asian eyelid, for example. It's
100%.
different, so you should know how to do it. I prefer, Hispanic, African American. Personally, if that was my whole practice, I'd honestly be a happier person because I just have a better rapport with that demographic of people. But as far as pricing, if you're from Beverly Hills, I'm going to charge you triple.
Yes.
Yes.
It really it really is interesting, and I probably shouldn't be saying this on the podcast, but I do turn around and bend over backwards at times. And if somebody can't afford my $25,000 breast reduction and they really need it, I'll take the price off. So yes, there are prices that are set in stone, but everyone in this office knows, especially me as a practitioner, I'm not going to say the other two are just like me. I tend to do things just as, I don't want to say favors, but I'll drop the price to make somebody happy or whatever it is. There are some prices set in stone. They're relatively high. I don't even know all of them because my coordinator deals with all of that kind of stuff. If your breasts are massive, sometimes insurance takes care of it. I actually did an African-American female who's like my girl. I've done everything on her. She wanted a breast reduction. I took her to the hospital on Tuesday and did it under insurance. And honestly, it'll pay me like $800. But it made her happy. I've done so many other surgeries on her. I'm like, something, let me hook her up. Let's get it done. So there is variability in cost, but I'm very expensive.
Yes. But I did want to say,
expensive, y'all.
Yes. But I did want to say that what Dr. Payman is saying is very true because, thank God I had saved my money. It was on a mission to more find the right doctor. And then when we met, there's opportunity for a payment plan. There's opportunity. You can put it on a credit. If these things matter to you, and on this podcast, we are very much self-love, as long as you're doing this for the right reason, for yourself, for your motivation, for your whatever. And I think I speak for Diana. Like, if you're doing this because your boyfriend is like, I like a girl with a big booty, that's a bigger problem. And you don't need to go to Dr. Payman. You need to go to a therapist, a psychologist, a psychiatrist. So you tapping into something else that Dr. Payman cannot address. So when we're having this conversation, it's more like, damn, I feel good. I'm working out. Whatever it is, the mindset. Like for me, it's like, damn, I feel good. I'm working out. I had Sophie. I'm finally feeling like I'm in my body. But fuck, my sports bra is not holding it up.
Wow.
I had to wear double sports bra. I had to wear Velcro. My back was killing me. And I think Payman was there when I woke up. And the first thing, I'm like, drugs. I'm like, whatever. And the first thing I said, I was like, or Phil, I said, my back. Oh my God, my back feels so light. And when I tell you, I went from chronic back pain to I literally have, very typical lower back pain from standing too long or from not stretching after a workout. But I used to be like this. Like I found my breasts weighing me down. There were so many reasons for me, besides also a little vanity. I wanted to wear a little spring dress and not have to worry about the bra strap. I had thought through all the reasons as to why. Again, my personal justification. There's no judgment here. But I was like, damn, yeah, I want to wear a little spring dress with a spaghetti strap because the rest of my body is pretty petite. So I decided to go that way. But I say all this to say, when I had conversations with Ava, who is an amazing staff member at Dr. Payman, it's always been something of like, well, let's figure this out. Let's work together. And then just to follow through every time I go in, it's again, I cannot speak enough of how welcoming and how knowledgeable, not just you, but everyone on staff is. So thank you so much.
But it matters because of you. It's how you are as well. It's, in life, you can go back into the Old Testament as treat others as you want, to be treated, right? Or the New Testament, I should say. Jesus spoke that on a regular basis. Treat others as you want to be treated. And if you're kind, if you're sweet, if you're nice to people, which you're so sweet and you're always in a good, you come in with a smile, they're going to give it right back to you, right? But if you're this just this horrible, resting, just awfulness. That's
Bitch face.
they'll probably give it back a little bit because they're like, okay, this is ridiculous. So I do think, Rocio, it's a testament to who you are as a person and how you treat people and how positive you are, because you really are. You're just so fun and so nice and you're just great. So yes, I think you probably get that everywhere you go.
Thank you.
She does. And to be respectful of your times, I know you're going into surgery. I don't know what you're doing. You didn't share it. Oh my God, I know it's going to be amazing.
I'm doing actually 2 breast cases. I'm doing a breast revision and a breast reduction. And the crazy part is I'm doing a breast reduction on one of my nieces. So
wow.
I've had
so that's extra pressure.
I've had enough anxiety about this for the last
extra
2
pressure.
weeks.
But we also wanted to bring Dr. Payman on to knock some of this some of this thing off. What is it called again? Oh my God, I don't want people to know that I had surgery.
The shame, the shame,
oh my God,
and
you know what I'm saying? Like
it's so ridiculous. I think that obviously you don't have to go tell everybody what you're doing. Sometimes it's obvious when your lips are about this big, but but in all reality, own it, enjoy it. In this day and age, we are there to kind of be incredibly empowered and positive about life. Now, I'm not saying go get the BBL and just walk around with the G-string on Instagram all day long, but there's really nothing wrong with owning what you've done and feeling great in your own body and your skin. I do have this conversation with everyone who ever has a breast reduction. I say, breast reduction surgery, hands down, for the last 50 years, there's been a questionnaire that's sent out by the American plastic surgeons. It has been the #1 most satisfied procedure that we do as plastic surgeons. And it is the most talked about and recommended procedure by women to other women because of exactly what Rocio said, taking the weight off the neck, shoulder, and back, making them feel so much better. So, what ends up happening is some procedures people are very open about because they feel like it wasn't like they changed themselves. They fixed post-pregnancy changes. They fixed those types of things. Or I got in an accident, I broke my nose, I straightened it, things like that. But when people go in and have a full makeover, and sometimes it's a little overdone, they don't want to own up to it. So I do think for the procedures I do, people are a lot more open to discussing. For some of the stuff that Dr. Layke does, or Dr. Resde does, it's a little different because they want to be like, no, this is how I look.
Right.
So,
but not even like it's so crazy because I've known people for real, like they go and get like a liposuction done. You've never wore a crop top in your life, but now at 50 you're wearing a crop top. Where did you get the work done? Like that's all. Like just share. Oh no, that's just I've just been doing this and this and that. No, honey. Be true. Oh,
I know.
Dr.
But nowadays,
how much time do you have?
Let's say 5 minutes.
Okay, perfect. Go ahead. Nowadays,
I'll tell you one last thing, Deep, is what you said about the liposuction. You don't know anymore if it's liposuction because everyone and their mother is on Ozempic and Mounjaro. So everybody's skinny. I mean, literally, like I see some of my patients that I've operated on, and they didn't look that good. And I'm like, wow, you made my results even better. It's hilarious. I'm a big advocate of it. I think it's fantastic if it's used properly.
Well, should I get Ozempic? That's what you're saying.
Yes, I really, really am. I'm telling you, the new studies that are coming out, the New England Journal of Medicine is saying that it is actually decreasing stroke and heart attack risk by 50% for people.
Because you're losing the weight.
What it ends up doing, it takes away so much weight that your body had to kind of handle and push out more blood, and your heart had to work faster and harder. And people don't have that load requirement, and it has made a huge difference. The downside to it is people are losing muscle mass. So for those of you that are taking Ozempic or Mounjaro, you have to eat a ton of protein. Recommendation is 100 to 150 grams of protein a day, which is like 2 steaks, which is crazy. And you have to do weight-bearing exercise. But if
that's
not,
a check. I do both of those already.
Yes, she does.
But low dose. You don't have to do the full dose. Just do low dose for maintenance. It is going to be one of those medications that we're going to use for longevity for a very long time.
Dr. Payman, I would love to. I wanna get this in quickly. How many men do you have come in, and what is the number one ask you have for men? Because I know we're talking on this podcast and people are like, oh, women, women, women. But when I went in there, I was like, oh shit, there's men getting all types of shit.
So, great question. My male demographic is less than my partner's, most likely because Dr. Layke is like a male model and as handsome as it gets.
He's insane.
So a lot.
He is.
No, but all kidding aside, he does a lot more noses and faces, and men really care more about their face and nose, especially as they get eyes, under eyes. Like my under eye bags are horrible this morning, but it changes your life when you just fix these. So he has his probably about 20%, maybe 25% as that high. Mine is probably a little less, and most of my procedures I do on men are liposuction. So whether it's liposuction of the chest or abdomen, love handles, number one place. So we do. So the beauty of it is the stigma has been kind of taken away from having plastic surgery for a man. So, and more men, and the whole thing is we're living longer. So when you're hitting 50, you're like, man, I'm, my wife's 20 years younger than I am. Okay. So I'm like, I gotta look good. So yeah. So when I get older, which is already now, I don't look too old for her. So a lot of that's happening as well.
I would love to end with, can you share with us your worst horror story? Like whether it's a client, whether it's someone, it has to be a client, I'm sure, coming back and even though you did your best, or like them not having the maintenance. Like I can imagine the stuff you deal with in Beverly Hills. I know there's got to be one that stands out, that it's like, if this person walks through the door one more time, I'm never going to perform a surgery again.
It's so funny that yesterday I get an email from one of the girls that work for me and said this girl came in again and made an appointment under a different name because we fired her because she was so toxic.
As a client.
And when she walked in, we're like, no, dude, that's you. You can't come in. So it's very interesting, and this building has like 60 plastic surgeons. Go somewhere else. She was so toxic to everyone. And then we fired her. She called in as a different patient's name, scheduled an appointment. Didn't realize when she walked in, people were going to be like, no, it's you. So, she wasn't. There's kind of sad stories where people get into bad accidents and fix their facial fractures and things like that. Those are always. But then there's also the breast cancer reconstruction stories that sometimes they don't go well. Sometimes they don't heal well. And those are the ones that really hurt because you're dealing with cancer, you're dealing with chemo, you're dealing with radiation. Radiation really changes the way people heal. And those are the biggest horror stories, but I still do it because I feel like it's helping someone and they really need it. Most of the cosmetic surgery stuff I do, I have to be honest, I just kind of, if I feel like there's a red flag, I just don't do it. Somebody comes in here, wants to give me all the money in the world to operate on them, and I think they're going to be super difficult. I just say, there's so many other plastic surgeons, go see them. I'm not going to give you what you're looking for. And I think that's how I've stayed out of nightmare stories. I have funny stories. I could probably write books and books and books on funny stories.
You should.
But
that's actually an amazing book.
That's an amazing story right there.
I used to tell Dr. Layke we should literally do like a 5-minute voice note every day after our full day, because there's so many funny incidences of different things that we can talk about. That it's just, we went in one day and we do surgery together a lot. Went in one day and this lady's like, I'm not taking my clothes off in front of you. And I'm like, what do you mean? They're like, you two are too cute. I go, how about we get him out of the room and I'll stand up. No, I feel it was so funny. I go, how are we going to see you?
Operate you?
People get very uncomfortable around Dr. Layke because he's so handsome and so nice.
So
he's just so nice. It doesn't make sense.
You're handsome too, though, Dr. Payman. Don't be dissing yourself. Hello.
Thank you.
He's not. He's not single. He's not available. Yay.
Exactly. Don't start stalking him because he's not available. He has
what's your weekend looking like?
So FYI, if you want to have surgery, just know you got to get naked. That's part of the initial procedure.
And you got to save your money. You got to save your money like I'm about to, because I'm in love with Dr. Payman, and I'm gonna get on that getting that little pill to try to get this little, because I've had 4 kids. Rocio has one. I've had 4.
She's had 4. By the way, her kids are grown. They're all in college. I
have a 30-year-old. I have
a 30-year-old.
Yeah, I have a 30-year-old, a 24-year-old, a 19, and an 18. So
you look amazing.
I do the working out and all that stuff, and I still got that little pouch, that little kangaroo. So yeah,
that's the problem. More pregnancies, more problems.
Getting pregnant is fun. So what do we do?
Yes, it is.
Exactly.
Dr. Payman, oh my God, you gotta go through surgery.
I'm gonna go through surgery. Is there anything else I can answer?
No, I mean we can talk for hours.
Gracious. Oh my gosh.
But thank you so much for your time. Hopefully we'll have a part 2. And just thank you. There's going to be tons of questions that come from this podcast and people probably inquiring. I do want to say that if someone was interested in potentially getting a consult, you guys do have initial opportunities for them to be done online, right?
Absolutely. So I do a ton of virtual consultations, just like you and I are talking now. I do it on my phone, sometimes even from my house. It's a great way to kind of just get the conversation started so people can understand, hey, what do I have to really deal with? And can I do this from New York, for example? Or should I go to someone in New York? And I always talk to them. I say, listen, I got a great guy in New York. If you want to go see him, I'll send you to him. Or in Connecticut, or all over the country, because there's a lot of good surgeons here. But some people are like, no, I want to come to you. And we go over it and set them all up. So there is, and that's the simple thing.
Perfect. Thank you so much, Dr. Payman.
Knocking off the taboo of the surgery. Yes.
It was a pleasure to speak to both of you. I'm going to go enhance someone's life right now.
Yes.
That's awesome.
Thank you.
Have a great week.
Gracias for listening to Cositas Mommy Never Told Me. We hope you loved this episode. Make sure you subscribe, follow, and share Cositas Mommy Never Told Me on all your social channels. Todas las redes sociales. And don't forget, if you want in on the real tea and see all of our reactions to the craziness, watch this episode on YouTube. ¡Qué bochinche!